When kids just won't listen, parents often feel stuck between two choices: to give in or get angry. It's exhausting. We give you the top techniques directly from the experts, helping you on your path to a more peaceful, respectful, and joyful life with your kids. Today we're going to learn how to get kids to listen from a physical therapist's perspective. Britta DeStefano is a pediatric physical therapist and owner of a mobile, in-home, and virtual practice called Progress Through Play, which supports children from birth to 5 years old and their families. She offers traditional physical therapy along with infant developmental wellness. Britta received her doctorate of physical therapy at Emory University, and she has worked in a wide variety of pediatric therapy settings, including in schools, outpatient clinics, acute care, early intervention, and rehab centers. She has also taught ballet classes for children with special needs. That sounds really awesome. Throughout her career as a pediatric physical therapist, she has become increasingly passionate about serving infants and toddlers and helping to establish the building blocks of motor development. In this show, Britta talks about how much easier it is to control the environment compared to trying to control the child. She also talks about why kids don't need so many toys in their play space and how to validate kids' emotions. Now here's Britta DeStefano. Britta DeStefano, welcome to the show. Thanks for joining us today.
Yes, thank you so much for having me. I'm excited to do this.
I'm excited too. I don't believe we've had a physical therapist on before, and how that relates to pediatrics is something I'm excited about learning from you.
Absolutely.
Let me start by asking, what is it that you most love about working with kids?
I love that in my job, I get to be more than just a healthcare provider for them. I'm getting to go into their homes and really be more of a friend and a support system for their families. And since my entire practice is structured around play, I just get to play with them and approach them on their level. And that's just really fun.
As a physical therapist, what would you say is the main thing that you've learned from working with kids?
I've learned that children are amazingly resilient. And over my career, I've just witnessed so many children overcome odds to make huge leaps in their development, take their first steps, participate in a sport, or with the little babies, even just work to hold their head up. And it's just really inspiring to see how hard these kids work on a daily basis.
Okay, so tell us about the environment that you're working in. I know that I believe I read you're doing a lot of working in the home. Is that right?
Yes. So I travel to children's homes so that I'm treating them in their natural environment. And so I can also go, say, to their favorite playground or to their preschool, but really I'm wanting to see how they're participating in their daily play activities and where they might be struggling so that I can help the parents kind of troubleshoot and give them ways to help work on that and make it part of their daily routine. So it's not kind of a sterile clinic environment. It's really something that increases the carryover, and the caregivers are able to really integrate it into their daily lives.
And can you help me bridge the gap in how it is that you're incorporating what play has to do with physical therapy? Because I have, in my mind, those are completely separate, realms of care.
Right. The children that I'm working with usually have some sort of developmental delay, and so they're delayed in basically being able to play appropriately for their age. And so what I'm doing is I am structuring our play so that they are working on the skill that they're struggling with. So say they don't have great balance to go up and down the stairs and they struggle with that so they can't get up and down the stairs to go to their basement playroom or something like that. I am structuring our session so that we're working on them standing on one leg. So we'll do big dinosaur stomps where they have to lift their leg really high and then they're standing on one foot, and that's practicing how they lift their foot to step onto a stair. And so I'm really just making it a game, but in the back of my mind, I know that we're working on these specific goals to help that child better interact and, play.
And when you were learning and training to become a doctor in this field, were they talking about play, or is this something that you've just picked up and seen that it worked? Kind of wondering where the play element came from in your training, if there was any.
Right. So in the training, it was a lot more about, assessing children for, whatever deficits they may have, and then interventions that you can do. But they didn't talk as much about how to structure it within play. And that's something that I've really just developed over the years. And I learned a lot about when I did an extra year of specializing in pediatrics. And I had some amazing mentors that really helped kind of teach me about that approach and how effective it is with children.
So I guess maybe the takeaway is we don't actually need to have a high degree of training to play. As kids show us every day, they're not trained to play either.
Right, exactly. So you're just using their natural, environment and play as a means to an end.
Yeah. Sometimes I think that I hear people struggling with kind of how do I incorporate play? How do I play? What is this all about?
That's what I love about my sessions, is that sometimes I just let the child lead it, and if they pick out a toy from my bag or a toy from their home, I can usually structure some sort of game around that toy that's working towards our goals. And so I really do like to let the child lead a lot of our sessions because they're more engaged that way.
And these are kids mostly like 5 and under, is that right?
Yeah, birth to 5.
So how does it look when you're starting with that engagement, when you're laying out those tools? Can you walk us through what that looks like?
Sure. So, it kind of varies based on which age kid I'm working with. But my first session is really just getting to know the child and the family. And I'm obviously assessing them so that we can set goals and figure out what my intervention is going to be and how that's going to look. But I want it to be fun. And so, the most recent evaluation I did was for a child that is obsessed with the new Aladdin movie. And he has his own magic carpet, and he had his little pretend hat. He was using a bowl as a little Aladdin hat, and he was singing the song. And I just made my entire assessment about Aladdin. And I was singing with him, and we were using the magic carpet to jump over and for me to see all these skills that I needed to see in order to know, what intervention he needed. And we structured it all around Aladdin. So I approach it that way so that I'm coming in on that friend level with the child. And so it's not intimidating to them, and I don't get resistance from them when we're wanting to work on something that might be challenging for them. It's just a lot of fun.
So you're starting that from the first interaction.
Exactly. Yeah, that was my first time meeting that child. And so I really want him to want me to come back and think of me as a friend who gets to come play with him.
So tell us about when it does start getting hard, when the kid is struggling. How do you handle that?
Well, because I see a lot of young toddlers, the 1 to 2-year-olds, I do a lot of redirection. Because we are playing with toys, and they can be very tempting for them to want to take everything out and explore it. That's their job. As a young toddler, their job is to explore the world and their environment. So I fully understand that. And I try to limit the amount of things I have set out for them so it's not overwhelming. But if we do need to redirect, that's what I end up doing a lot is, okay, you really want to play with that toy? Let's play with it in this manner, instead of, banging it on the wall.
What I think people may be concerned about is that if they're trying to redirect a child, that they feel like they're kind of chasing them all over the place, which I guess with a 2-year-old, that's kind of common.
Yeah.
Do you have any tips for engaging in a way that doesn't require so much redirection?
Parent involvement.
Yeah.
Yes. So I really recommend controlling the environment as much as you can. So like I said, not having a lot of toys out really helps your child with more purposeful play. So having only 3 toys in their playroom is actually much better than having 100 toys in the playroom. And so you can rotate them out and keep them away in a closet, but setting out something really helps them to not get into that overwhelmed state where you're constantly having to redirect because they're not playing in the way that you want them to. And it's so much easier to control environment than to control a child. I mean, it is. So I really recommend, if your child is a climber, just set out a bunch of couch cushions all over and some stuff that they can just climb all over safely so that you don't have to constantly be like, no, don't climb on the table. No, don't climb on this, really just setting them up for success so that you're not having to say no all the time.
Yeah, I love that. Controlling the environment.
Yeah.
So you mentioned kind of maybe cutting down on the number of toys or options for them. Is there anything else? Mm-hmm. How else can we control their environment?
Making it safe is a big thing. So if there's things you don't want them to be doing, make sure we're taking that away from where they would be playing. And let's see, I think that's just it. I mean, safety and decreasing stimulation. So making sure that there's not a ton of toys with lights and sound and music and all of that, which can be really overstimulating to their nervous system. So maybe only one toy that plays music and then some other toys that don't. That can also help kind of keep them regulated.
Does that apply to all children, or is that something you would just recommend with kids with developmental delays?
No, I think that applies to all children. I mean, we all have this nervous system that we're constantly trying to regulate throughout the day. I mean, adults too. You feel it when you're a little bit more anxious or you're feeling nice and calm, and kids have that, and they even have a harder time kind of figuring out how to regulate that. And so if you can help them by just setting them up for success and not giving them a lot of overstimulating toys all at once, that can really help them in terms of, like, when a child is throwing a tantrum, that's a signal that they're not regulating their nervous system well and something's going on there. So any little thing that we can do to kind of help that regulation and help them learn to regulate their nervous system is going to be really helpful.
I have so many questions. Okay, so
yeah.
So tell me again, when the child's having a hard time, and let's say they're throwing a toy across the room or something, you've already taken the steps to limit the number of toys, let's say, and of
right.
course you've made the environment safe.
But they're still doing it.
Yeah, but they're still doing it. How do you handle that?
So I really like to tell parents that we want to show and tell your child what you want them to do, not what you don't want them to do. So instead of telling them no or don't throw, the child, all they're hearing is throw, which is the thing that they want to do. They're throwing their truck against the wall or whatever. And you're telling them, don't throw. And all they're hearing is throw. So I tell parents, show them what you do want them to do. So instead, say, trucks are not for throwing. Let's throw this ball, and hand them a ball. Because obviously what the child is wanting in that moment is to throw. They're craving that. And so, telling them, you have to go play with the truck this way, that's not what they're wanting right now. They're wanting to throw. So I say, find a way for them to do that behavior in a safe way. So give them a ball or a cushion or something soft that they can toss. And that's usually more effective than telling them, don't throw, go play with the truck this way, in the correct manner that you would want a truck to be played with. It seems to work a little bit better for their little brains to see what you want them to be doing.
And to play a little bit of devil's advocate, now you've given the kid something else to throw. Aren't they just going to get even more carried away? And now you're enabling, this behavior that's causing a problem.
I think if you're able to redirect them to the behavior in a safe way, like throwing a ball is totally appropriate. And it's actually a great developmental skill that they need to develop. So I think when they're able to get it out of their system in a safe way, I don't really look at that as enabling a bad behavior. I look at it as being able to get what they're craving out so that they can move on to the next thing. Because if you don't let them kind of get that motion or that movement or whatever they're craving out of their system, then they're not really going to be able to regulate very well. If you're trying to move them on to a new activity that they're not ready for, that's going to kind of cause some dysregulation in their systems because it's not kind of what their body wants in that moment. Does that make sense?
Yeah, absolutely. Absolutely.
Okay.
So, I mean, and I guess one way to think about that is you're going with them to some degree. You're not
right.
You're not fighting. It's not a fight. You're finding a way to say yes to what they already want to do.
Exactly. And I think just decreasing that amount of friction between you and your child is also just helpful in regulating yourself as well. Because parents, you get dysregulated too when you're constantly stressed about telling your child no. And so when you're regulating your own nervous system, that helps to regulate your child's as well. And if you're both nice and regulated, it's just a much more harmonious relationship between you and your child.
You said that tantrums are kind of a sign of dysregulation. Well, maybe what are some signs of dysregulation and or what are some other kind of methods that we can become more regulated?
Right.
Mm-hmm.
So different children will react different ways to having their systems dysregulated, but some kids will just completely shut down. Other kids will get very kind of out of control and wild, or they might be screaming. Some kids lash out physically, so they might hit or throw toys or, kind of demonstrate some of those behaviors that we don't like. And each child kind of reacts differently to ways to help regulate them, but some of them need just to kind of go to a calmer environment, like go into a nice safe space. If it's, kind of a chair in the corner where, there's not a lot of toys around and they can have a nice blanket or a pillow to hug. A lot of kids do really well if you sit down and just get really close with them and hold them. You don't even have to talk, but just sit and hold them. But some children don't want to be touched. When they're dysregulated, touch kind of isn't what they're craving. And so you kind of have to do just some trial and error to see what your child responds to when they're in that dysregulated state.
Is that state something that comes about from their minds or their bodies? Would a child be dysregulated because they're hungry, or is there something that they're thinking about and we can talk through it?
Yeah, it is. It's kind of a mind-body connection, but hunger is definitely a trigger. It's kind of that fight or flight mode where they just don't know how to fix what they're feeling in their bodies. So that might be hunger. It might be that they're tired. It might be that something hurts. It might be that they're just overwhelmed with their sensory systems. So too much visual input coming in from flashing toys, or too much auditory input coming in from, other screaming children might dysregulate your own child because it's just too much information coming into the brain. So it could be a feeling in the body. It could be something coming from the brain. But what it ends up in is that fight or flight mode where they just bubble over and they don't know how to regulate their systems back down. And that's just something that they kind of learn over time. Children aren't born really knowing how to regulate themselves.
How can we help identify what the cause of the problem is?
Again, it's kind of trial and error. So, if you kind of know your child and maybe they're off their normal sleep schedule, you can think, okay, well, maybe they're dysregulated because they haven't had a nap in 2 days. Or, if we normally do snack at these times and they haven't eaten in a while, let's try food first and see if that kind of helps regulate. And you can kind of just go down the line and see what kind of helps bring them back down to a regulated state. And then you can also help them start naming what they're feeling. So if you found out, like you give them some snacks and all of a sudden we're back to being regulated, you could say, I could tell you were very hungry. So maybe we should have snack a little bit earlier so you don't get so hungry, and help them name the feeling so that in the future, hopefully they can learn to tell you, Mommy, I'm feeling hungry, as opposed to getting all the way to that dysregulated state.
I like the idea of, well, first of all, when we talk about, controlling the environment, and now when you talk about the regulation or the dysregulation of a state, it's also depersonalized. It's kind of externalized from the child as a person. This is the child's state, and so it's almost like another kind of external factor that we can kind of operate on without looking at the kid and saying, hey, this is a bad kid.
Right. You're not blaming the child. Yeah, exactly. It's not something that they're doing purposefully, and they're not doing it to spite you or, it's not personal. It's something that, yes, it's their nervous system that's really controlling it. And yeah, you don't tell them like you're a bad kid because you're having this tantrum. You're really looking at it from a different perspective.
I'm going to try to summarize some of the things I've heard you say when it comes to working with kids under the age of 5. And a lot of it seems like it starts before you ever come in contact, or, setting the stage ahead of time in controlling the environment. So, that's something you would set up before your, difficult moment or any moment. You've got your bag of tools, but you also could shape the environment to make sure that it's not too stimulating. And then, I hear you talking a lot about looking out for dysregulated states, which might look like tantrums or shutting down, and finding ways to address that. And a lot of times that's simple redirection, where you're, like you were saying, here, don't throw the truck, throw the ball. It's a way of kind of going with them.
Yeah.
Yeah.
I'm all about working with the child on their level and meeting them exactly where they are.
Yeah. And you also mentioned kind of naming the feeling. Can you tell us about how that works? What's the goal there and what that accomplishes?
Well, you're really looking to validate the child. So I can tell you're very frustrated that Mommy had to turn the TV off. And I'm so sorry that would be very frustrating if you wanted to keep watching TV and we can't anymore. And so you're letting them know that you understand and that it's okay to feel that way. And the same way with the redirection. I can tell you really want to throw right now. So let's throw a ball. Let's validate your feeling and what you really want to do right now. And that's so powerful for a child to feel validated by their parent. And it really just reduces friction between you and your kid.
So that's one of the first things you're going to at that kind of point of conflict, is that validation.
Exactly.
And I heard you say it's so powerful for a child. I don't know if you've tried it on adults, but
it's powerful for adults as well.
Oh, yeah. Interesting. All right. So here's a silly question I sometimes ask, is about how we can kind of summarize all of this in something short and pithy that I can remember next time I'm stressed out. Do you have any ideas there?
Absolutely. So I like to use the phrase connect and redirect. So you're connecting and validating, and then you're redirecting to a safe behavior. So connect and redirect is really an easy one for parents to remember.
Yeah. And the connecting, again, it might be you're naming a feeling. Earlier you talked about physical touch. It seems like there's a lot of ways to connect.
Absolutely. Yeah. That can look different for each child, or in each situation. It might look different. It might be you just naming a feeling. It might be, sitting down with them, however it looks in that moment. But yes, you're connecting, and then you're helping them to redirect to a safe behavior.
Right. And the redirect isn't just, hey, look over there, while you take their toy away that they were enjoying.
No,
It's
exactly.
more of a, what's the word, kind of supplementing or modifying what it is that they're engaged with.
Yeah, I like the word modifying. Yeah.
Besides your own website and Instagram, etc.,
Yes.
what resources do you recommend for people with kids of this age or any age?
Yeah, I really love the book, The Whole Brain Child, which is by Dan Siegel, and he's the one who really talks a lot about connecting and redirecting. So if you want to learn more about that and just the neuroscience behind it and how your child's brain is developing and how that affects their behaviors and their emotions and all of that, it's just a great book that kind of encompasses all of that. And then if you do have a child that seems to be a little bit more dysregulated or quote unquote difficult, I really like the book, The Out of Sync Child, which is by Carol Cranowitz. And then the last one, which works really well for me in terms of regulating my own self when parenting my children, is Peaceful Parent, Happy Kids by Laura Markham. And that really just helps you learn to regulate yourself when you're interacting with your child, and to really understand, you know, what type of triggers you might have in your relationship with your children, and how not to yell and to have a more peaceful environment in your house.
Let's talk about some of your stuff. What is Progress Through Play?
So Progress Through Play started as a kind of concierge mobile physical therapy practice here in Denver, where I'm traveling to children's homes to treat them. And I'm also really focused on infant developmental wellness. So getting in and educating families prior to there being a red flag or a delay. I really am passionate about early intervention and just the fact that all parents deserve to have knowledge about their child's development. And the more knowledge they have, the more connected and in tune they are with their child, because they're more understanding of what's happening in that child's brain and body in that moment. And so I really, really love educating families about, you know, their child's motor development. And so because of that, I've also branched out into offering those infant developmental wellness sessions virtually as well. So I can offer those to anyone outside of the Denver area as well.
I'm assuming that people are calling you when they have a problem, when the child has a problem.
Mm-hmm.
Do you ever get the opportunity to work with folks, or are your services, you know, appropriate for just a typical 2-year-old?
Absolutely. And that's why I really like the wellness side, is that I can look at children across the whole spectrum of typically developing to maybe having an actual developmental delay. I really, that's kind of the way I formed my practice, was that nobody would be turned away. You don't have to be, you know, a certain percentage behind to be able to receive services. I think everybody deserves to have that knowledge and understanding. And so, yes, I offer my wellness services to typically developing children as well, so that everyone has access.
Can you describe how the virtual stuff works?
Absolutely. So my virtual sessions take place over a video Zoom call. And so a parent would have their child with them, and I would tell them how to set up their environment so that I can get what I want out of the session. And then I would talk a parent through kind of positioning the child how I want, so that I can assess whatever we're working on. And then it's a lot of me educating the parent and giving them a lot of tips and tricks to help promote new skills. And then I send them a whole wrap-up email with all of my recommendations and things that they can implement in their daily routines. And then we check back again in a week or two and see how that went, and do another session to kind of, see how the progression is going.
Well, it's awesome that it's interactive, that you're actually looking at their kid and helping them with their problem. It's not just YouTube videos, giving blanket.
Right. It's more personalized.
That's great. And where can we find all of that?
So my website, which is ptpdenver.com, and then my Instagram, which is at Progress Through Play.
All right. PTP stands for Progress Through Play, Denver.com.
Yep.
Cool.
Absolutely.
Well, do you have any parting thoughts? Anything that we skipped over? I know it kind of went fast.
No, I don't think so. I think just remembering to validate your child and in that moment and help connect better with them and then redirect.
Great. Well, Britta, thank you for being with us. I really enjoyed talking with you. And I think you have a lot to offer. I know that we just kind of scratched the surface of, these concepts, connecting and redirecting, but probably can go on and on about what exactly that means and what that looks like, especially for kids under 5. So I hope everybody checks out your stuff.
Yeah, I hope to see you all on social media or on my website.
Well, again, thank you for your time. Everybody who's listening, thanks for tuning in, and we'll see you next time.